Good afternoon, everybody. It's a pleasure to be with you today and to have this opportunity to talk to you about Valtoco, diazepam nasal spray for the use in cluster seizures in individuals 6 years of age and up. So what is Valtoco? Well, it's a prescription medication that's used for the short-term treatment of seizure clusters, which also may be known as episodes of frequent seizure activities, or in some cases, you may have heard the term acute repetitive seizures. And as I said, it's indicated for individuals ages 6 years of age and older. Now, you could ask yourself, what are episodes of frequent seizure activities? Individuals may experience frequent seizure activities that occur 2 or more at a time within a 24-hour period, and they look different from an individual's usual seizure pattern. Now, some individuals may have referred to this as acute repetitive seizures, breakthrough seizures, multiple seizures, or repeated seizures. So you could hear many terms used for this experience of cluster seizures. So why would you need to have a rescue treatment? Well, I think we all know that seizures are unpredictable. In fact, 3 of 4 individuals living with epilepsy worry about having a seizure at any time. And seizures can happen, as you know, 4 out of 10 people continue to have seizures even when they're taking anti-seizure medication. So what this means is that there is the possibility of a rescue therapy for individuals to use at the earliest possible time if someone continues to have repeated seizures that could even become an emergency. So when you think about these episodes of frequent seizure activities or clusters, it's important to think about having a seizure action plan, because a seizure action plan can help the individual with epilepsy communicate or tell others how to respond if a seizure should occur. So this is a plan that is something you should work with your doctor or your healthcare professional team to develop if you have epilepsy or someone that you love or help support in their epilepsy care. And the plan is actually tailored for each individual person. Now, we have an example up here on the screen on the right side, but there are many different formats for developing a seizure action plan. But what's most important here is that the plan provides information on what a typical seizure looks like, how someone can help the individual during a seizure, and when and how to treat the seizure with a rescue medication. And when necessary, when they might need to seek additional emergency assistance. So, as I mentioned, there are a number of forms of seizure action plans that are available for you to download. The one on the left is the Epilepsy Foundation's form. The one on the right is the Seizure Action Plan Coalition. But your doctor, a school system, if you're in a group home, many other individuals or organizations have these plans available for you to fill out. Now, the Epilepsy Foundation form comes in several different languages for individuals who are not as comfortable with English as their primary language. And there is a form specifically designed for children who are in the schools. So let's talk about Valtoco, which is the diazepam nasal spray. So as I mentioned, this is an FDA-approved on-hand seizure rescue medication for acute treatment of frequent seizure activities, which often are known as seizure clusters. And it's a very small, discreet nasal spray created for the safe administration by non-medical care partners like family members, friends, and coworkers. Now, this does not replace standard anti-seizure medications. It's used in conjunction with that. So it's always important to stay on those medications as prescribed. Now, Valtoco is tailored for individuals in terms of it comes in 4 different dosage strengths, and the dose that is right for the individual who needs it is based on the individual's age and weight. And as you can see here, the different dosage strengths are color-coded for convenience in recognizing them. The other thing I want to point out is that the 5 and 10 milligram dosage strengths have 1 sprayer for a complete dose, while the 15 and 20 milligram strengths, you need to give 2 sprayers to give a complete dose. So important things to remember should you be prescribed or need to assist someone in the administration of Valtoco for a cluster seizure. So let's talk about some of the benefits of Valtoco. Well, one, it is approved for use by anyone. It doesn't have to be a medical person. It's ready to use, so there's no assembly required, and you don't have to prime it. The dose is tailored. It's easy to carry for use wherever you need it, whenever you need it. So it's school, daycare, camp, college, or work, or visiting friends. And there's no need to refrigerate it. You just should protect it from light and keep it at room temperature. So again, I've already showed this to you, but it is very small. And again, it's ready to use when needed. So let's talk about some of the resources that are available to you if you should need to use Valtoco. Well, one thing is that the company does provide a Neurelis personalized support program. It supports the individual with epilepsy and any care partners if they were prescribed Valtoco, and help them if they need to learn how to use Valtoco. They also offer savings and support by checking to make sure it's covered by the insurance company the individual may have. There's a copay assistance program available, and other assistance that may be available to qualified individuals. They also have a group of nurse educators on hand to help train anybody about the use of Valtoco. So this could be the person with epilepsy, the caregiver, care partner, co-workers, teachers, families, whatever, so that they can feel confident and comfortable using the medication. They also can answer some general questions about Valtoco. There is a demo kit that is available upon request. This is what it looks like. It's fully equipped with brochures and information about the product, and also has a demo sprayer, just like the one I was showing you, to help get comfortable with the safe administration of the product. It also provides, the site also provides seizure action plan templates and can help connect you with advocacy groups or support groups that you might find very helpful. So I recommend that if you have someone that is on Valtoco or thinking about Valtoco, if you are on it, please visit the myneurelis.com or call them for some of these resources that are available to you. Now, just to reiterate, this medication is approved for individuals aged 6 years and older. It's using the compound diazepam, which has been around and used for as a rescue therapy for more than 20 years by non-medical care individuals. It can be promptly administered, and it provides an on-hand rescue relief. And as we've already talked about, it's very small and discreet, so it's easy to carry around and to use. Now, there's a few important safety things that I want to cover with you today before we conclude the presentation, and that is that Valtoco is a prescription that is used for short-term treatment of seizure clusters in individuals 6 years of age and older. And as I already mentioned, it's not intended to replace the anti-seizure medications that you may need to take each and every day. It's a federally controlled substance because there is the potential for abuse that can lead to dependency. So you do want to keep it in a safe place and make sure that you only use it as prescribed. The other thing, if you have had issues of dependency or abuse in the past, you do want to make sure you discuss that with your healthcare provider as you think about the use of this medication. And again, we don't know about the safety and effectiveness in children under 6 years of age. It's really only for children 6 years of age. So what else is important to know about it? Well, it's a benzodiazepam. And with all benzodiazepams, regardless, you need to be very cautious if they are used in combination with opioid medication, alcohol, or any other central nervous system depressant, like some of the street drugs that may be out there, because they can cause severe drowsiness or breathing problems that can lead to coma and death. So again, if there should be an occasion or someone needs to take Valtoco, they are on opioid medication, it's something to really talk to your doctor about and make sure that if any modifications need to be made during that period of time you're on the opioid, that you can discuss that and do so. There's also the chance of a risk of abuse and misuse, which we've talked about. So again, only use as prescribed. And the one thing I think that's very important as we think about any benzodiazepam is that it can cause increased thoughts of suicidal ideation or actions and difficulty breathing. So make sure that if any of these things were to occur, you should go to the nearest emergency room right away to deal with them. We've already talked about the fact that you can have physical dependency because it is a benzodiazepam, so you need to use it exactly as it was prescribed. And in this case, it's recommended by the package insert that you only use Valtoco once every 5 days and no more than 5 times per month, unless you're advised differently by your healthcare professional, but that is what is recommended in terms of usage. It can cause some sleepiness and drowsiness and dizziness. So if you were to engage in any dangerous activities like working with machineries, the child wants to go out and play on the jungle gyms, if they just had Valtoco, it is something you may want to modify until you know that that person has really recovered back to their baseline. And like with all anti-epileptic drugs, they all can cause suicidal thoughts and actions. And while it only occurs in a very small number of people, about 1 in 500, it is something to be on the lookout for, especially if you are dealing with someone who is already having, thoughts of depression or mood change or behavior changes, talk to the doctor about that and pay attention if any of these things should get worse, so that, again, together you can work out a plan that's best for that individual. Now, the one thing with all medication, especially this medication, like everything else, is if you're allergic to diazepam, make sure your healthcare professional knows that. If you have acute narrow angular glaucoma, that is something to talk to your doctor about, because you should not be using Valtoco. But before you take any medication, including Valtoco, make sure that you talk to your doctor about any pre-existing medical conditions you have. In the case of Valtoco, specifically, you want to focus on any breathing issues like pre-existing conditions with asthma, emphysema, chronic pulmonary disease. Again, if you have a history of depression, mood swings, also if you have any history of liver or kidney problems, things that you really need to converse with your healthcare professional team about. And if you plan to get pregnant again, or are pregnant, make sure your healthcare professional team knows about this. And that includes breastfeeding too. And it's always wise to tell your healthcare professional about any medication that you're taking, whether it's prescribed or over the counter. So always read the information that you're provided by your prescriber. Use the Valtoco exactly as your doctor told you to do. Again, only use it one time. It cannot be reused. After it's used, you just want to throw it away like you would dispose of anything else. Use all the medication in an individual pack, because that is a complete dose. And then make sure that you are carrying it around with you so that it is available should a seizure occur. So you have it at your fingertips. It's only used in the nose. So make sure that before it is administered, that the tip is actually in the tip of the nose so that the medication is delivered appropriately. If you're the one who's helping the individual, make sure that you stay with them as they recover from the seizure, and also to watch them after the administration of Valtoco. One, you want to make sure that the seizures do stop. You also want to make sure that they're recovering from the seizure event. And if they were to have any serious adverse events associated with the administration of the medication, the seizure lasts longer than it should, whatever, you want to be able to get them the help that they need and possibly call 911. If the individual does need a second dose of Valtoco, they can take it 4 hours after the first dose. Again, that would be a new pack, but don't give any more than 2 doses at a time. And as I said, it's no more than once every 5 days and no more than 5 times a month. So the most common side effects people have reported is feeling sleepy or drowsy, having a headache, or having some nasal discomfort. If you have any side effects or have any questions about that, certainly report it to Neurelis or to the FDA, but your healthcare provider is your main source of information, and you should talk to them about any experiences you might have regarding side effects or your response to the treatment. So again, for your benefit, I've got the Valtoco.com website up, which has a lot of information that I've talked about today for you, or you can contact the 1-866-MY-Neurelis for information on how to use the product, information on seizure action plans, and any other support you may need. So with that, if there's any questions.
Hey, Nancy, this is Chris Ware from Nile. I had a question about the seizure action plans. Where where do those go once they're completed? How are those used for patient care?
So in school age children, you have to have one every year at the beginning of the school year. If you have someone that like is in a group home setting or um, a workshop setting, a group workshop setting, it's always good to give them to the staff or anyone that might be assisting them with a seizure should one occur. For individuals who are gainfully employed, kind of more out and about independently, I think it's always good to write them down and then to sit down with someone who might be a support person to you on the job or even socially to tell them what it is you need them to do and give them a copy, especially if you're going to be spending a lot of time with them. I think they're the best ways to use the seizure action plan. Did that answer your question?
Yeah, I guess the follow-up would be, is there any need to communicate that information to a medical professional once the seizures occurred, as far as triage or getting more information to a healthcare provider?
Well, I think healthcare providers always like to know if someone is still having active seizures. So it's good to keep some sort of seizure diary to either report back to them at the next visit or send them a note through My Health, online communication tools that you might have. If you started the seizure action plan yourself, and again, I don't want people to think that these have to be started by the healthcare providing team, support team. They can be started by the individual. It could be started by the school themselves, whatever. It's always good to share the plan with your healthcare professional team to make sure there's alignment on what to do, when to do it, and if there is to be any medication administered, how to administer that medication.
Okay, great. Thank you very much.
Any other questions? Then I guess we should turn it back, or
It was definitely fine.
Hi, doctor. If nobody has any questions, yeah, you are all set. And then the next talk is at 1:30. SK Life Science will be presenting EXPO.
great.
Thank you so
Thank
much
you.
for your time.